Hi, good evening, everyone. Welcome to my presentation. Now we can discuss. Now we can discuss the topic MCQ on hormones. So let us see the first question. Increased suicidal tendencies associated with low level of serotonin, high level of serotonin, low level of dopamine, high level of dopamine. So what is a suicide? Suicide is nothing but the act of ending one own life. One own life is called suicide. So what neurotransmitter change cause suicidal thought? The answer is B. High level of serotonin. High level of serotonin causes suicidal thought. Not only that, it is also causes anxiety too. Low level of serotonin causes depression. Remember, low level of serotonin causes depression. High level of serotonin causes suicide as well as anxiety. The next question. Deficiency of which of the following neurotransmitter is associated with depression? Deficiency of which of the following neurotransmitter is associated with depression? Already we have discussed in this question. Serotonin. Serotonin deficiency is associated with or is cause of depression. Low serotonin or 5-HT level are found to be cause of many cases of mild to severe depression. The next third question. Major neurotransmitter in parasympathetic. Major neurotransmitter in parasympathetic is acetylcholine, adrenaline, noradrenaline, dopamine. The answer is acetylcholine. Then organophosphate inhibits. Organophosphate inhibit neonic site of organophosphate inhibits neonic site of acetylcholinesterase, ester site of acetylcholinesterase, none of this. Organophosphate inhibits answer ester site of acetylcholinesterase. The next question, the pharmacological action of adrenaline includes. The pharmacological action of adrenaline includes vasoconstriction, increased in heart rate, vasodilation, both A and B. The answer is both A and B. Both A and B. So adrenaline or epinephrine. So this is the hormone which is responsible for vasoconstriction and increase in heart rate. So vasoconstriction is nothing but blood vessels, the contraction of blood vessels is called vasoconstriction. Then here you can see adrenaline or epinephrine has the capacity cause the vasoconstriction by making reaction with B1 receptor. Epinephrine by reacting with the alpha receptor, it causes vasoconstriction, and by reacting with beta receptor, it causes increase in heart rate and cardiac output. Then two receptors are included in this. The next one, epinephrine reacts with which of the following receptors? Epinephrine reacts with which of the following receptors? The answer is adrenergic receptors, cholinergic receptors, muscarinic receptors, nicotinic receptors. The answer is A. Adrenergic receptors. This epinephrine, by activating these adrenergic receptors, it causes the vital function. Okay, it starts the vital function that is fight or flight response of sympathetic nervous system. The next question, corticosteroid suppresses baroreceptors, perine receptors, immune response, neural transmission. Baroreceptors, the function of this baroreceptor is it has the capacity to detect the changes in BP and blood value. Is there any changes in blood pressure or blood value? So that change can detect by these corticosteroids, these baroreceptors, and these baroreceptors located on the blood vessels. Okay, then corticosteroids suppresses baroreceptors, pain receptors, immune response, and neural transmission. The answer is immune response. Why? Because this immune actually, look at here, this corticosteroid, the function of this corticosteroid is reduce the inflammation in the body. The use of the corticosteroids is reduce the inflammation in body. Sorry, I forgot what I said before. So this one is the function of baroreceptor. Okay, the function of this baroreceptor is detect the changes in blood pressure and blood volume, and this baroreceptor is located on the blood vessels. And corticosteroids. The use of these corticosteroids drugs are reduce the inflammation in the body. So here what is the question is, corticosteroid suppresses the baroreceptors or pain receptors, immune response, neurotransmission. The answer is immune response. Why? Because this immune, what we call high immune responses causes inflammation. Okay, high immune responses in the body causes inflammation. So that's why this corticosteroids decreases or suppresses the immune response. The next one, mifepristone is an example of progesterone antagonist, estrogen antagonist, progesterone agonist, estrogen supplement. The answer is progesterone antagonist. Actually, this mifepristone has the capacity to block the progesterone. Progesterone is a pregnancy maintenance hormone. Okay, so that's why this mifepristone we call progesterone antagonist. Nothing but against progesterone it is acting. So that's why we can call mifepristone is a progesterone antagonist. So the indication of this mifepristone or misoprostol drug is used in the medical termination of pregnancy or abortion. In abortion cases, they can use this mifepristone drug. Then, for a client with hypothyroidism, treatment is most likely to include. For a client with hypothyroidism, the client has hypothyroidism, high level of thyroid level. Treatment. What is the treatment of choice here? How to give a thyroid hormone antagonist, thyroid extract, a synthetic thyroid hormone, emollient lotions. The answer is have to give the opposite to hypothyroidism. We have to give the thyroid hormone antagonist. So this thyroid hormone antagonist has the capacity to block the thyroid hormone synthesis and reduce the production of thyroid hormone also. Then next question, which of the following action is not caused by oxytocin? The functions of oxytocin are ejection of breast milk, contraction of myoepithelial cells, uterine contraction. Lactogenesis is not a function of oxytocin. Lactogenesis is nothing but the process of milk production. Lactogenesis or milk production is not caused by oxytocin, but for this process, this prolactin hormone is essential. So prolactin hormone is responsible for lactogenesis or milk production. So other actions, these three actions are responsibilities of oxytocin. The next question, in which of the following condition the drug epinephrine is not used? So epinephrine already we have discussed, flight or flight response. It creates the fight or flight response. Okay. So here the answer is anaphylaxis, local hemostasis, chronic bronchial asthma, all of. The answer is in chronic bronchial asthma, it is not a drug epinephrine is not indicated. For anaphylaxis or allergic reaction, for local homeostasis, nothing but maintenance of internal condition stable is called local homeostasis. For these two process, the drug epinephrine is needed. The next question, mineralocorticoid causes. Mineralocorticoid secreted by adrenal cortex. So the function of this mineralocorticoid is it maintains the fluid and electrolyte balance in the body. So it causes sodium reabsorption, glycogen synthesis, gluconeogenesis, lipolysis. The answer is sodium reabsorption. The next question, prolactin secretion is inhibited by dopamine antagonist, gamma aminobutyric acid, neurophysin, bromocriptine. Prolactin secretion is inhibited by The answer is bromocryptine. So bromocryptine controls the hyperprolactemia. Hyperprolactemia increase the decrease it causes the decrease the hyperprolactemia. Nothing but it inhibits the prolactin secretion. The finally milk production. It decreases the milk production in the mother. So drug of choice to inhibit the milk production or prolactin secretion is bromocryptine. Then all are released from pituitary. All are released from pituitary gland except growth hormone, prolactin, ADH, glucagon. The answer is D, glucagon. Then growth hormone release is controlled by options: growth hormone releasing hormone, dopamine, follicular stimulating hormone, corticotrophin releasing hormone. Growth hormone is controlled by in question itself it has the answer is GHRH. Then thyroxine is synthesized from cysteine, arginine, tyrosine, lanine. The answer is C, tyrosine. Then L-tyrosine is used in thyroid storm, cretinism, endemic goiter, Graves' disease. My dear students, so in next class we will start with MCQ with this question. If you like my content, please subscribe my channel. Thank you all.